My name is James Davis, and I will be presenting my research on the stability of ocular alignment after teprotumumab therapy in a cohort of patients with thyroid eye disease and baseline diplopia. Thyroid eye disease is an orbital inflammatory disease that can cause problems with ocular surface disease, proptosis, optic neuropathy, or diplopia in patients with autoimmune thyroid conditions. Teprotumumab is a monoclonal antibody that is effective in treating patients with thyroid eye disease. It has been shown to produce subjective improvements in diplopia in patients with thyroid eye disease. Many patients with thyroid eye disease and double vision undergo strabismus surgery to correct ocular misalignment and improve their diplopia after the thyroid eye disease is deemed to be in remission and the ocular alignment has stabilized. Strabismus surgeons typically wait for ocular alignment to become stable for at least 4 to 6 months before considering a patient stable for surgery. However, it is unclear if this guideline is suitable for patients with thyroid eye disease following the relatively new teprotumumab therapy. The aims of this study are to evaluate the rate and timing of recurrence or worsening of diplopia after teprotumumab treatment in a cohort of patients with thyroid eye disease presenting with baseline diplopia. This was a retrospective chart review of patients with diplopia secondary to thyroid eye disease who were treated with teprotumumab at Johns Hopkins. The primary outcome was the rate of recurrence or worsening of diplopia after completing teprotumumab therapy, and the secondary outcomes included the time to recurrence or worsening of diplopia and clinical activity scores to correlate with changes in ocular alignment. Recurrence or worsening of diplopia was defined as a change in ocular alignment by 6 or more prism diopters in the horizontal plane, or 3 or more prism diopters in the vertical plane. Clinical activity score is a 10-point metric system based on clinical signs to determine if thyroid eye disease is active or not. And a summary of our results can be found in Table 1. As shown in Figure 1, 15 patients met the inclusion criteria for this study, and 7 of those had recurrence of diplopia, which is a staggering 46.7%. As shown in Figure 2, during the follow-up period, 2 patients had worsening of their clinical activity score to 4 or more, indicating definite recurrence of thyroid eye disease. 6 patients had worsening of their clinical activity score to 3, indicating a high risk for recurrence, and the other 7 patients had clinical activity score of 2 or less, indicating low risk for recurrence of thyroid eye disease. Table 2 shows the mean follow-up period at 20.4 months after completing teprotumumab therapy, and the mean time to diplopia recurrence or worsening at 8.8 months. This study evaluated the recurrence or worsening of diplopia related to thyroid eye disease in patients after treatment with teprotumumab and found that 46.7% of these patients had recurrence or worsening of diplopia, most of which recurred within a year after completing therapy. These results should prompt caution among strabismus surgeons considering thyroid eye disease patients for strabismus surgery shortly after completion of teprotumumab treatment, as there may be significant risk of recurrence of thyroid eye disease, and thus a potential change in ocular alignment. Though prior recommendations suggest waiting for at least 4 to 6 months after resolution of thyroid eye disease activity before determining a patient to be stable for strabismus surgery, it may be advisable to extend this waiting period for patients who have been treated with teprotumumab to avoid the potential of additional surgery. We recommend that patients and physicians carefully consider the risk of disease recurrence and possible changes to ocular alignment due to thyroid eye disease when discussing together the risks and benefits of strabismus surgery following teprotumumab therapy. Thank you.